do I do about my? So I want to make it full screen. Yeah. Okay. So I'll start with my first slide, where I usually quote this quotation by Swami Vivekananda. There is no chance of welfare of the world unless the condition of women is improved. It is not possible for a bird to fly on one wing. Can I just get a little indicator from the other side that you're able to hear me clearly? If somebody can just type a little yes or any.
Yeah, Dr. Mangal, yes. Your voice is loud and clear. Please go ahead. Thank you.
All right. Great. Thanks. So the role of the gynecologist or the healthcare system in the life of women, I would say, is all the way through. And our job is to look after the woman's health to the best. Just to make you aware about the basic, the reproductive structure, so that you're aware about the terms which is commonly being used when any of your health report related to the gynae is being discussed. So uterus, the uterus is the womb or the organ which carries the baby, and also is the one which is responsible for causing the menstruation. By the side of the uterus you have two tubes and the ovaries. Ovaries produce egg every month from the time of puberty till the menopause. The mouth of the uterus is called as cervix. I guess you must have heard about cervical cancer and the screening program for cervical cancer and the vaccine available for that. I'll discuss in detail about it further. And then the vagina and the opening of the vagina. So these are the main organs which usually are being talked by your gynecologist when they discuss about your any other results. So I generally like to cover the following topic, starting from pregnancy, pre-pregnancy, family planning, menstrual irregularities, menopause, and a bit about the gynecology cancers. Now, as far as the working women are concerned, we do know that because of the career, the family planning is very important, and I know there are a lot of reservations about the use of the family planning methods as a contraception as to their side effects. I've worked here both in India and abroad, and I see a lot of myths about the contraception which prevail in our country. As the science is progressing, the way the pharmaceutical companies are doing research and the medicines are getting better, the kind of contraceptive pills available in the markets are very, very safe for most of the women. So rather than not using any contraception when you are not planning pregnancy, it is always better to use contraception rather than ending up in a situation where you are having an unwanted pregnancy. So by which I want to sort of again emphasize and say that a career woman, when you plan everything, when you plan your career, when you plan your exams, you plan your holidays, similarly your family planning should not be left unplanned. So that's the one important message which I would like to give you, that you need to obviously discuss with your gynecologist the need of your contraception and using appropriate contraception so that you can plan the pregnancy when you are ready and you are not having a surprise and then in a situation where you are not wanting the pregnancy. Similarly, when you are planning for pregnancy, you need to go for a preconceptional counseling. If you have any pre-existing medical disease, then all the more important that you need to see your doctor so that your medicines can be changed to the safer medicines. Your condition, like if you have diabetes, blood pressure, epilepsy, can be made more controlled so that your pregnancy can be as successful as possible. Another important thing here is a BMI, which is body mass index, or obesity. We do know that the problem of obesity is increasing because of our lifestyle. Most of us, we work long hours sitting at one place and then mentally exhausted but physically not doing much of exercise, leading to the weight gain, obesity, and overweight. Again, when a overweight or obese woman plans pregnancy, the risks are higher for her when she is pregnant. So again, it is important that before planning pregnancy, a woman should make sure that she is in the best of her health, and as of even her weight should be within the normal range that is advisable. Another point here I would like to highlight is about folic acid. So what is folic acid? Folic acid is vitamin B9, which is a supplement which a woman should be taking while she is pregnant. While she is pregnant, as well as when she is planning for pregnancy. So ideally what the recommendation is that 3 months before the woman is become pregnant, she should have taken the supplement for folic acid. 400 to 800 microgram is a sufficient dose, and certain medical conditions warrants higher dose of folic acid. Now, what is the importance of folic acid? Folic acid is a supplement which will help in preventing certain neural tube defect, which is a kind of defect in a baby which can happen, leading to the defect in the brain and the spinal cord. And this fact is very well established that folic acid helps in reduction of majority of these cases. So a very simple measure which can prevent from having certain problems in the baby, then that should be advocated. So most of the time this is not done because the general population is not aware about it. On the other hand, also the people who are smoking and drinking alcohol, they should avoid smoking and alcohol both. As far as alcohol is concerned, when the woman becomes pregnant, then there is the recommendation now, or the recent recommendation is that she should avoid alcohol altogether. The alcohol during pregnancy leads to again the hyperactive syndrome in the baby, and affects the brain development of the baby. So alcohol and smoking should be considered before pregnancy. Similarly, there are certain vaccines which needs to be checked beforehand, whether the woman has been immunized. And again, the last point on my slide, it says about to avoid contact with toxic substance and material. In that case, your workplace, obviously depending upon what sort of work you are in, if you're working in the factory where if there is exposure to any chemicals, then you need to make sure that it is safe when you're planning for pregnancy or while you're going to be pregnant. So again, just to summarize, folic acid, calcium, and DHA, it's always in newspapers and all, you read about the big three, of which these are the big three which they generally talk about, folic acid, calcium, and DHA. So a healthy lifestyle with good nutrition, including the nutrients like folic acid and calcium, plays a good role to have a healthy baby. Can I take a pause here to ask my audience to let me know anything they want to touch upon regarding the preconception counseling? Then I would, or else I will move on to the care during pregnancy.
We request all the audience to please key in their queries about the segment of topic that Dr. Mangal has just completed. Thank you. Dr. Mangal, there seems to be no questions on this particular part, and I'll request you to please continue with your presentation. Thank you.
Thank you. I'll proceed. And so, gonna move on to the pregnancy. So I've talked about that planning the pregnancy. I've talked a bit about contraception. As I said, there are lots of myths about contraception available. So don't make the decisions without having the information. Go and seek advice from your doctor and make appropriate choice. And
Dr.
seek
Mangal?
conceptual counseling.
Dr. Mangal,
Sure.
we just received a question from Ms. Prerna Nigudkar. She is
Okay.
asking that how can we measure the quantity of folic acid?
Okay. You usually get the medicines mentioning the dose of the medicine, like how much is the content. In India, most of the folic acid available is around 5 milligrams. It is absolutely fine to take a higher dose folic acid as it's not going to cause any harm because excess of that gets excreted. So if you're not able to get 400 to 800 micrograms pill, then you can go for the standard pill, which are usually available, which is 5 milligram. If you have been abroad, then there are usually the multivitamins with prenatal and other sort of trade names available, which has usually 400 micrograms of folic acid available, and that is sufficient. Okay, so I hope that answers your question.
We have a couple of questions more.
Sure.
Ms. Shabaz MD. She is writing, during pap smear test, is bleeding normal or not?
During pap smear is a test. I would be covering pap smear later, and probably I'll cover at that time. But I'll keep this question in mind, and I'll answer this question later.
Right. Another question from Prerna Nigudkar. Which food products should be consumed for the same to meet the requirement of folic acid?
Sorry, I missed the last bit.
Yes, Dr. Man, I am repeating the question. Which food products should be consumed for the same to meet the requirement of folic acid? Same means she's
Folic acid, right.
folic acid, yes.
Folic acid is rich in coriander, parsley, and few herbs. Some of the food available in the supermarket is fortified with folic acid, like they would be written on the packet that this cereal or food or flour of wheat is fortified with folic acid. So those are the source of folic acid. But in general, in your daily cooking, it's good to use parsley and coriander as a garnishing thing, which gives you folic acid as well. Okay, so I'm going to move on to the next topic.
Yes, please,
is,
doctor. Yes, please. Thank you.
Talking about the pregnancy, we have in Columbia, Asia, a special Venus program in which we obviously look after mother from the beginning and the whole 9 months and even beyond after the delivery of the baby. And this program is launched with the name Columbia Venus, which is running very successfully in our hospital. Now, why the antenatal care is needed? It's been now obviously long many years we have established that when you look after the woman in pregnancy, then there are certain problems which can be avoided and pregnancy can be managed better, so that the outcome of the pregnancy is with regards to mother's health and the baby's health is better. The common problems which we face in pregnancy is the blood pressure going high, for which the mother, we check on every visit, we check the mother's blood pressure. High blood pressure is a common problem in the last trimester of the pregnancy, which we divide the pregnancy into 3 trimesters, first 3 months, second 3 months, and the last 3 months. Diabetes is a very, very common problem which we are seeing today in India, and more so in the working class population. The kind of population which I look after is most of them are the working women. And in my clinic, the incidence of diabetes, I would say, is around 35 to 40% in pregnant mother, which is a very high incidence. And diabetes, usually the woman would develop in the 7th month of the pregnancy if she doesn't have diabetes from before. We also have women who are at a younger age nowadays have diabetes and embarking the pregnancy with pre-existing diabetes. Monitoring diabetes and controlling the sugar levels in pregnancy, controlling it has shown that the outcome of such pregnancy where the sugar levels have been controlled is almost the same as the low-risk pregnancy where the woman doesn't have diabetes. So this is something very, very important, that during pregnancy the woman is checked for diabetes. If there is diabetes, then she is taking measures to control it, obviously under the guidance of the doctor and the gynecologist. Yeah, so women's health, I usually say that it's in our own hand. Until and unless we take responsibility of our health, the others are not going to look into it. Family planning, briefly I have discussed before, so just going to again reiterate: be consistent, use contraceptive device properly, and be committed. Moving on to something, topic which I really like, this is called as a prevention. Because when we talk about the health, and I think I'm talking to most of the women who are healthy, and we are here to discuss about that how we can prevent the health problems coming. So we define the prevention into the 3 levels: primary, secondary, and tertiary. So primary is where we are trying to prevent the disease. Example of one of that is use of folic acid preconceptionally, which is going to prevent the disease. Secondary prevention is where you are going to detect the disease early and then manage it early so that the complications of that disease is not there. Example for that is, as we discussed, that during pregnancy to detect the blood pressure, to detect diabetes, or otherwise also to detect these problems which are common. The common health issues are detected early and they are being taken care of. And tertiary prevention is obviously when the target person has already had symptoms of the disease and had damage, and then to provide rehabilitation and making sure that person is living as healthy life as possible is tertiary prevention. I'm going to move on to the next topic, which is related to menopause. So I've got a little quiz, which I know I'm not going to be able to do that here. So I'm just going to read the question and tell you the answer. That how many women of age 50 and over will have osteoporosis related fracture in their lifetime? And the answer to this question is, to our surprise, is 1 in 2 women. So which means elderly women, the fracture of the bones is the very, very common problem, and that happens because of osteoporosis. Okay, what percentage of people with osteoporosis are women? So majority of osteoporosis is the osteoporosis happen in women as opposed to men. And answer to this question is 80%. If you are taking osteoporosis medicines, then you need the bone density test done every 6 months, 2 years, 3 years, 5 years. And answer to that is every 2 years. And if you are a woman above 50, you need a regular calcium supplement. The dose of the calcium is as high as 1.2 grams, which is 1200 milligrams. The calcium supplement or the calcium should be taken daily. Calcium doesn't need to come from the tablets only. It can come from the natural sources of calcium, which is mainly the dairy products. And that's why it's important when we say that the women after the age of 35, they should make sure they are having enough quantity of milk so as to keep their bones healthy. exercise can increase bone density. Now, what is bone density? Bone density means how heavy your bones are. And heavy your bones are, that means the more calcium is there in your bones, and the less likely the bones will break if you slip or if you fall. And doing the exercise do help in improving the bone density, and that's true. And the reason why this happens is the way exercise helps with the metabolism, it helps in moving the calcium from the blood to the bone. So it helps in the deposition of the calcium on the bones. Moving on to another topic, which is about cervical cancer. It's very close to my heart, and it's very close to my heart. It's something which is preventable, and as I said, in cervical cancer, we have got primary prevention, which is in the form of vaccine. The vaccine is recommended for young pre-pubertal or pubertal girls, which is like when the girls are at the age of 9 and 10, before they have started their periods or before they are sexually active. If the vaccine can be given to them, then that can provide them a lifetime safety against the cervical cancer. That is one. Secondly, we have talked about primary prevention for cervical cancer. Secondary prevention is to detecting it early. And with cervical cancer, there is a screening test, Pap smear, which I'm going to answer the question about the Pap smear, which was asked early. Pap smear is a test where a slide is, some cells are taken from the cervix, it's put on the slide, and the slide is reviewed in the lab by a pathologist to tell us whether there are any abnormal changes in the cervix or not. Now, with the cervical cancer, the natural history of cervical cancer is very long, which means from the changes from minor abnormality to actually moving on for that abnormality to become cervical cancer, it takes long years. It takes around 10 to 12 years before it becomes a cancer, which gives us an opportunity to pick up those minor to moderate abnormalities and treat it completely before it converts to cancer. And that's what the Pap smear does. We are not trying to pick up cervical cancer by Pap smear. We are trying to pick up the precancerous stage of the cervix, whereby we can treat that precancerous stage completely, and the treatment for that is 100%. And it's a simple treatment for that. It's not a major surgery. So that is the beauty of this Pap smear screening test. Unfortunately, such kind of screening test is not available for many other cancers. Now, the bleeding at the time of Pap smear. Generally, we don't see a bleeding at the time of Pap smear, but in some cases, despite being normal cervix, there can be light bleeding. That is because while taking the smear, the cervical lining is scraped with a wooden spatula. That can sometimes lead to the little bleeding. So bleeding is not always an obvious sign while taking the Pap smear. Okay. So I here want to take a pause again and see if my audience has anything to ask me or discuss with me. Thank you. Hello. We have, yeah. Hello. Oh, right. Any questions from the audience, or do you want me to carry on?
Yes, Dr. Mangal, we have a couple of questions here. First one is, the question is from Ms. Saumi Banerjee. She is asking how to detect osteoporosis.
Osteoporosis runs in family, so there is usually a genetic history, one. Osteoporosis usually is seen more commonly in a woman who have had an early menopause, and the osteoporosis is detected by doing a test called DEXA, or a dual densitometry test. This is a very simple test and which tells us what is the density of the bone. And depending upon if the density is normal or is abnormal, the treatment can be offered to the woman for osteoporosis. Usually that needs to be taken after the woman has become menopause. So in the reproductive age group, the estrogen hormone, which is one of the hormone of the female reproduction, it is a protection for the female bones, which keeps the bones healthy. And that's why this problem happens more after menopause. So women, the people who have family history in the mothers and sisters, and after the menopause, they should have the bone densitometry done to find out what is their bone density and accordingly manage it.
She is also requesting what would be the symptoms of osteoporosis.
You would not like to wait for the symptoms, because symptoms is basically when you are slipping and your bone breaking with the slightest of slip. So you don't want to wait up till your osteoporosis is set in, because once the osteoporosis is set in, then to revert those changes are difficult. So that's where there's a role of prevention. So you are going to prevent the osteoporosis to come in. And unfortunately, the symptoms are not going to tell you early.
A question from...
if in your family, if in the family, if you know that your grandmother has had fracture or your mother has had a fracture after the menopause and took longer to heal, then they need to get a bone densitometry done. Test which is very easily available, and usually there are in fact free camps done to do this ultrasound method of the densitometry testing, and so it's just good to know beforehand.
The question from Ms. Shabnaz MD. She's asking, is PCOD problem will not be cured with medicine?
Okay. Yeah, PCOD is a very common problem in the reproductive age group women. PCOD is a syndrome. It's not a disease like diabetes. So PCOD happens because of the metabolic problem, which is thereby leading to many sort of symptoms because of PCOD. And we never try to treat the PCOD. That means we are not aiming to correct the PCOD. We always aim to treat the symptom or the problem which is PCOD is creating. So how the PCOD usually presents? It presents with irregular period, and if that is the problem, then you help the periods to become regular with the medicines. If the problem is that a woman is finding difficult to get pregnant, then the treatment is with regards to the fertility, so that the medicines are given so that she's getting pregnant. If the PCOD is related to the increased weight gain, then the treatment is related to that, so that the woman is able to maintain a normal healthy lifestyle and a normal BMI. So you don't try to treat the PCOS. So the answer to the question is that no, you cannot cure PCO. You can actually help the condition to be better. Okay, so do I just carry on now to the next topic? This is about, not about the health, but this is about something what we practice in medicine. And I want you out there to know that this is how we practice medicine. We practice what is called as the evidence-based medicine. Now, what does that mean? That means that Dr. Bhavna doesn't decide that I'll treat PCO like this because I have good results. No. I would treat a PCO or any other condition based on whatever is the research available out, and based on that research, what has been shown that this is going to make difference, and then we use that practice as a base of our practice in the for particular causes. To explain you a bit more about this, that means, say, if somebody is having headache, then we ask them to take paracetamol. We know that by so much of research done on this medicine and the use of this medicine, that this medicine is going to by and large help most of the people as a pain relief. So in medicine, we don't go by that, oh, I feel that's why I'm doing this. No. We do what is being proven to be of help, and that's why we do this. So it is not doctor's choice that the doctor is doing this because doctor wants to do this, but there is evidence or literature behind it to support what we are doing it. And this is what the medicine which is being now practiced across the world. So the purpose of the medicine is obviously to provide patient care, public health and research, and improving the quality of the patient's life. And that's what the evidence-based medicine is. Evidence-based medicine is the conscientious, explicit and judicious use of the current evidences in making decisions about the care of individual patient. So I'm just going to skip this bit. So what we practice is integrating evidence practice. Now certain healthy heart goals for women. So I usually sort of end my presentation with a slide saying that most of the women, and especially the working women, everyone should know their number. And the number of what is your total cholesterol, what is the bad cholesterol, what is the good cholesterol, what are your triglycerides, and what is your body mass index. So I've shown the normal range, and which generally by that I mean that every so often you need to have your health checkup to make sure that your numbers are right. And if your numbers are not right, then you need to take measures to get them right. Thank you. At this point, I would be happy to take a few more questions before we finish.
I will now request my colleague, Ms. Sulagna Chatterjee, to please open the questions and then read out one by one so that Dr. Mangal can respond to them. Thank you.
Thank you, Mr. Rao. Thank you, Dr. Mangal. That was an excellent talk for the past 45 minutes, and I'm sure that, like me, everyone else who was a part of this webinar was taking note of every little thing that you were giving details on. If any of the participants have any question, I think this would be a good time to put down your questions. We are getting a number of questions, but because we are running out of time, we promised Dr. Mangal we'll make it very quick. We'll wrap it up by 5. So if you have any questions, could we have the last few minutes dedicated to some questions? Mr. Rao, would you be having access to those questions? Mr. Rao, are you able to hear me?
No, I am able to listen to you.
Okay, so I was just telling before we wrap up, if there are any other questions, maybe 1 or 2 which we could ask Dr. Mangal to answer before we close.
Yes, sure. Dr. Mangal, we have at least 5 to 10 questions here. So may I read them out so that you can respond to them?
Yeah.
Hello.
Okay. Samaranika Mohanty is asking, what are the symptoms of cervical cancer?
Just
Okay. Cervical cancer, again, if you're leaving the cervical cancer to come up with symptoms, you're late. And as I mentioned that our aim with cervical cancer is not to pick up cervical cancer, but to pick up